Hello and welcome to Prescribing Creativity, a part of Prudential Presents North to Shore, produced by NJ Pack. Thank you all for joining us today. To open our panel discussion, we'll start with a performance by Alana Jackson, Director of Arts and Wellness at Dr. Phillips Center for the Performing Arts. Alana Jackson is a songwriter, performer, and spoken word artist who performed original works in cities spanning from NYC to Belfast, Ireland. Welcome, Alana.
This is more than statistics. This is humanistic linguistic sea. Lyrics run through my veins and my blood runs treble clef and bass. So if our current reality is not music to your ears, then you know that we don't have time to waste. Because being sick is expensive. And being well is well, priceless, but well worth every penny we give it. And we are spent. We are spent. We are spent. And so I am pondering pensive. And at the risk of providing care that is truly comprehensive, well, I have a marriage proposal for all of you. What if every hospital, health department, community center, school had access to Arts for Health programming to address their own most pressing concerns? What if, before anyone could check, or even check into an institution at all, even the streets were filled with the preemptive power of the electric slide as a line of line dance prevention? What if when grandma went to the doctor, she was given even more than another pill and another bill? What if, as part of her prescription, she was actually pointed to a community of movers and shakers that shared her childhood love of dance, reconnecting her with the musical sounds of her heyday, showing her that, hey, her condition was no obstacle to her capacity? Well, hey, our condition is no obstacle to our capacity. See, people and programs like these, they need a we to be in existence. Who are we to stay the same in our separate silos when the world that we live in is demanding something different? Let's do something different that stretches us across the distance of our disciplines, our divisions, and our differences, and let's make stars out of our scars. Because as they say, the wound is the place that we can let the light in. The wound is the place that we can let the light in, and maybe art is a way that we can let the light in. So let the light in, because people need healing and policies need changing, but we can't do that without you and you and you. We need the power of your languages to rewrite our policy to the music of transition and keep tempo with the art that lives in each of us, which means we need you in order to remember that sometimes feeling pulled in two different directions like medicine or music, stability or art, is actually the key to our equilibrium once we allow them to coexist. Art and health are not mutually exclusive. After all, we have to ground before we can leap. We need a standing leg to bounce us on so we can turn to face another direction. We have to stabilize, to mobilize, and visualize to realize we have always required different parts to make something greater than their summation. Even opposing forces, they push and pull and they make things move. So if you will help me to find my leg to stand on, then hey, I can help you find your way to see the sky has never been the limit. So dance with me and let's drive out dis-ease and let's meet and then exceed the CDC's recommendations for exercise for adults. Dance with me and let's stand arm in our kick line and kick down the walls and barriers that are keeping our kids from having safe places to ride their bikes. And let's help them ride off into the sunset of their fullest potential. Instead, dance with me and let's demonstrate and advocate prevention as a road to cure. Calling all the healthy people 2030, we gotta bankhead bounce our way back to becoming more resilient to public health threats like the ones we are facing today. We have too much to lose if we don't find our groups so quick. Bust a move, dance with me. Let's pulsate with the power of the people and listen in as we add the arts to our needs assessments. Let our synergy be the cure that lowers our blood pressure. At the same time, it's the catalyst that lowers our energy of activation, activating our community to their opportunity to move from the congregation of spectate into the aisle of access and active participation until healthcare becomes synonymous with a more perfect union. Dance with me and let's rock like crazy to the music that opens us up so we are primed to tell and to receive the stories that will stomp out stigma and bring us closer and closer and closer to equity, to efficacy, to empathy, and to each other. Your voice to my vocation, my creations to your geolocations, making place and making space for a healthier future become our global realization, because we are more than just caregivers and patients. We are ancient, long lost friends, and our combination is the stuff legends are made of. So dance with me, because life is movement, right? Right? That heart thumping, blood pumping, foot stumping, rhythmic music, and it don't stop, and we can't stop, and it don't stop, and we can't stop, and it don't stop, and we can't stop, because if it did, it would all be over. Thank you.
Wow, I am pretty speechless after that. What an unbelievable introduction, illustration of just how intertwined arts and health are. Alana, that was beautiful. Breaking, taking these buzzwords we hear, prevention, cure, CDC recommendations, and just grounding us in the art of this all. When we talk about our health, we're talking about our lives. And yeah, if the comments in the chat just speak to what a beautiful and touching introduction that was. So thank you so much, Alana Jackson. We all, I think, need that beautiful, beautiful poem posted on our walls as a reminder of what this is all about. And I just want to welcome everyone to this webinar. We've got a really great group here, 127 of you from all around, not only the country, but the world. I love that some folks have already taken to introducing themselves in the chat. Please keep that up, and please keep questions coming as we go through this panel today. We want to hear from you, because after all, as Alana's poem, I think, moves us to realize we're all part of this movement for arts and health, for making them one, for making them part of the fabric of our healthcare and our lives. So on today's panel, let's just take a moment to step back and realize that we are making history right now. The folks at NJPAC, Horizon Blue Cross Blue Shield, North to Shore, Prudential, this is a historic moment. This is the first time in US history that an insurer has supported an arts on prescription program. And this builds on the templates of many, many other excellent arts prescribing programs, thousands of years of research and literature and practice around integrative health, holistic healing, centering art as a part of our medicine. But what you're all witnessing today is a little piece of history, and I'm so grateful you're here with us. We've got a really excellent packed panel. I'm going to introduce them one at a time by way of a question. Then I'm going to pop some questions over to the group. And like we said, we're going to leave it to you as well to pop some questions in the chat that we'll have some time to answer at the end. So without further ado, we have a great panel of experts here from healthcare, arts and community sectors. And I guess I should introduce myself as well. I'm Julia Hotz. I'm the lucky journalist who's just bared witness to this historic moment. I've just written a book about social prescribing. This Arts on Prescription pilot is featured. But what I'm really excited to talk about is just, the story behind this story. How did we come to this historic moment? And first up, leading us, we have Maureen Zimmer. Maureen is a licensed clinical social worker, clinical supervisor, behavioral health at Horizon Blue Cross Blue Shield, who brings more than 20 years of experience working with adults and adolescents with mental health and substance abuse issues. She's currently guiding Horizon's collaboration with NJPAC. Hi, Maureen.
Hello. Hello. Thank you for that introduction.
Thank you so much. And I'm curious, Maureen, tell us about what you're finding so far. In your practice, how do you see prescribing art as something that improves patients' well-being?
Yeah. So, what I feel is it offers individuals and members in Horizon, patients, just regular people, an opportunity to look at non-traditional methods of connecting with others, to to have a positive distraction from their day-to-day issues, whether it be a physical health need, a behavioral health need that bogs you down. So outside of looking at the medications and the therapy appointments and the doctor's appointments and the physical therapy and all those traditional avenues, looking at what speaks to you, what brings you joy, what gives you connection and life, and how that really impacts health and well-being. And I see that, at least in the pilot that we've been doing, with a lot of positive interest from the Horizon representatives that can bring this to their members, and the interest that our members are having in having this available to them. And so that's kind of where I see it at this point.
Brilliant. I want to come back to that from the provider's perspective as well, what this is bringing you and folks supporting this. But that's so beautiful. I think you're right that these arts prescriptions can bring people joy and well-being in a new kind of way. It can build connection. And our next panelist, Teresa Tante Wilson, can also build on this. Teresa also brings 2 decades of experience to the health promotion space, is also a theater practitioner, so walks the walk and talks the talk. She's currently the director of health promotion and division at Rutgers University Newark, one of the most diverse college campuses in the nation, where she educates, trains, and mentors peer leaders on the intersection of well-being and social justice through 2 teams, Students Health Advocates, and her applied theater company, Unity. Hi, Teresa.
Hi, hello everyone, and shout out to my Rutgers colleagues in the audience.
Woo, woo. Yes, a lot of Rutgers love in the chat. So speaking of Rutgers, I'm curious, Teresa, if you could talk about how do you see arts prescriptions as benefiting not only your students, but also their families and the greater campus culture?
I was really excited to hear about the arts prescription program because one of the things that we look at a diverse campus college is how are our students getting access to the arts and to improve their well-being. And it really was about, can we look at reducing disparities? Can we look at fulfilling needs of students and be able to provide that space for them? And what I love about the program is that not only do students get to attend art programs within our community that they might not already have access to, but they can also bring a family member, a friend, and they can switch that person out. And that really allows for connection. So it can be, hey, I'm a caregiver and I might not have the time to be able to take, my little sibling or maybe a parent that I'm caregiving, but maybe I can bring them with me. And so that allows for connection on a deeper level. And also what I love is that our referrers get access to the program as well. So it's not just the students, but also our student leaders, our faculty, our staff are getting real, authentic experience in what it means to have access to the arts. And that helps to create that culture of well-being that we're cultivating at Rutgers. So it's very exciting.
I love so many things you touched on there. You're really making me remember the fact that family medicine, family doctors, we've long appreciated the role that a family plays in an individual's health. And I love that through this program, it sounds like you're able to sort of, restore that framework of seeing your students as a product of the families they live in and getting to involve them in the arts prescription. That's so beautiful. And yes, lots of questions for you, as I see we've also got some folks from other universities joining us. But I wanna pass it over now to Ketlin Asbrook, who was appointed to serve as the director for the City of Newark's Department of Health and Community Wellness and CEO for the Mary Eliza Mahoney Health Center. As the director of the state's largest health department, and CEO of a federally qualified health center, Ketlin oversees a budget of $65 million, which supports a wide spectrum of public health services, including surveillance, prevention, treatment, social support, community engagement. So Ketlin, thank you so much for joining us and bringing so much expertise to this space.
Thank you for having me.
So I'm curious, sometimes I talk about social prescribing, arts prescribing. Sometimes I hear the argument, people don't need an arts prescription. They can just go to the museum themselves. They can take themselves to a concert. I'm curious, what would you say to that argument? What are you finding among, Newark residents and how this is impacting them?
I mean, I would say that, I wish it was that simple, but that is not the reality that we're facing when, almost 1 in 4 Newarkers are living below the poverty level. The New Jersey Institute for Social Justice, I think some of you may already know these stats, but, they estimated that the median income wealth for white households in New Jersey is well over 300,000, compared to just 17,000 for Black households, and I think it's 26,000 for Latinx households. And Newark, which is the largest city in the state of New Jersey, is 85% Black and Latinx. That kind of wealth disparity impacts how people live. It greatly limits their opportunity to take advantage of the arts and cultural district, the thriving arts and cultural district that we have here in our city. And that's unfortunate. We could talk about food insecurity, we could talk about the cost of childcare and other factors, but I'll use housing as a point of reference. Approximately 70% of Newarkers are renters. Meanwhile, the median gross rent in Newark is, I think, $1,300 a month, which is about $16,000 a year. And so what that means is you have the majority of residents who are experiencing housing burden. And the reality of that is when you're experiencing housing burden and you're economically stressed, how do you prioritize the value and the benefits of the arts and cultural opportunities that we have here in the city? It's just not the reality for many of our residents. And so I say all that to say that, this program, this Arts on Prescription program is going to bring an opportunity to the residents of Newark that many cannot afford at this moment to benefit and take advantage of. And that's just awesome.
I love that so much, touching on so many important themes there. And after all, this is not just about arts and health. This is about arts and health equity. And some of those stats really illustrate how this is a means to maybe achieve some of that health equity. Lots of questions and points we want to come back to with that. But before we do, I just want to introduce our final panelist. We have Ali Meyer-Lakuta here. Ali is the Senior Director of Arts and Wellbeing at NJPAC, who's helping to lead this history-making pilot, and is the perfect person to do this because before this, Ali worked at NYC Health and Hospitals, where she helped lead the largest public mural initiative since the WPA. And more recently, she advised the first social prescribing pilot in the US, Culture RX, out of Massachusetts, which was a tremendous success and is what led to this. So Ali, now, first of all, hi, thank you for being here.
Hi, thanks for having me.
So Ali, now that you've led several arts and health projects, you bring so much insight to, I think, a big question that's on a lot of our minds as we witness this first in the nation sort of pilot. How did this happen? And what would it take, I'd say, to replicate the spread of the idea of arts on prescription?
That's a great question. How did this happen first? And what is it? Second, maybe. How did this happen? Really through really dedicated partnerships, I think is the answer to that. You know, we held roundtables with our health partners, getting everyone on the same page and saying out loud, right, that we value the arts, that we value and know and respect the role that the arts play on health and well-being, and we want to be part of a program that capitalizes on that. Getting all of our arts partners in Newark together and excited about being engaged in a program like this where we just for folks who don't know, our Arts on Prescription program provides 6 months of free arts activities for folks who receive the referral into the program. But we pay the arts organizations, the participating arts organizations, for those registration costs. So we send people to free activities and paid activities, and we pay for those paid tickets. And so a lot of you know, kind of careful cultivation of those partnerships is kind of like how it came about. And I think in terms of replication and kind of spreading the idea of arts on prescription, I really think that there needs to be a greater kind of public and institutional understanding of how the arts contribute to health and well-being. When I talk to stakeholders, like I have a slide in my deck, right, that talks about the evidence base for arts and health, that arts engagement lowers loneliness and depression and increases social connection and cohesion and really improves tangible physical and mental health outcomes. I'm usually met with like, you know, this look of like, nodding but curiosity, right? That like, yeah, that sounds like it makes sense, that the arts make us feel good, but they don't usually realize that there's a really rich evidence base now that provides a scientific foundation for this work, which I think is really helpful to get kind of institutional and policy making buy-in. So we hope that this, like, we're part of a larger kind of movement and reimagining of the role that arts centers and arts organizations play in their community as drivers of health and well-being. I think just the last point would be like to kind of start where you are. The pilot that you do might not be perfect from the start, but be willing to try and start and kind of iterate as you learn.
I love that, Allie. So many great points there. And yes, thank you for actually explaining what this pilot I keep referencing is and how it works. So one question I want to pick up on within this that I would toss back to the panel, we could sort of do this popcorn style, is about making the case that this is something worth institutional investment from our insurers, from our universities, from our health centers. I'm curious for each of you, if you could talk about when you're explaining this concept for the first time, what have been some of the powerful sticking points that have been successful in demonstrating that, yes, this is something that is worth institutional investment?
Sure.
Teresa, start. Thanks, Teresa.
Yes, I can jump in. You know, we were lucky to be funded by the grant from the Office of the Secretary of Higher Education. And so we were able to get funding from that perspective. In order to get the funding, what we really talked about was how taxed our clinicians are on campus, and that we need to spread how we're offering access to services that help to improve mental, emotional well-being, as well as well-being in general. And so how can we have access to the arts, not just through art therapy, but from a well-being perspective? And then a lot of the things that we looked at are what are the needs of our students and how would this fulfill a need that we did not currently offer on campus. And so to remove the tax from the clinician perspective, offer a well-being perspective where we're thinking, you know, I think about the PERMA model of health when we're thinking about the positive psychology perspective and really thinking about how are our populations thriving and how are we building community. And that's really the perspective that I use to help to get the funding for this.
So from my perspective, when I'm approaching, I work at Horizon Blue Cross Blue Shield, and I work with different departments to get their engagement to bring this to our members. So I work with a variety of different departments, and majority of them are working directly with our members in a case management approach, whether it's on the physical health side or whether it's on the behavioral health side. And it can be exhaustive, as many of you are probably aware, dealing with people who have had long-term illnesses that are tired, and they could be, be suffering from depression, anxiety, not wanting to get out. The big selling point, one of the big parts, is that they can go with someone else. They're not having to go individually, that they can have that support of a friend, a family member, to go to an event together. So not only are they having that emotional support to be able to get out and do something and have that connection, but additionally, then they have the exposure, whatever that may be. Dance. And you see this in the hospitals and in a therapeutic approach. We utilize music, we utilize art. And this is because we all tune into different aspects to bring out our mood, to touch us. And so this piece, I think, is a big selling point, right? You're being able to tap into something that our members are now interested in, that brings a little life.
I would add too, similar to what Maureen has said, is that, the power of the arts has always been with us, right? We know the arts have been used as a healing tool throughout the ages and cultures and societies and religion, singing and dancing and chanting, drawing and painting. But the deeper understanding of the impact on the brain, I think, is relatively new. Thankfully, there are new sciences that have emerged. I think neuroaesthetics is something that I've been researching as a result of this collaboration with NJPAC, which, more formally studies the intersection and interactions of the brain and aesthetic experiences. And that's a good thing. I think the more we're able to debunk the assumption that the arts are just a frivolous source of enjoyment and substantiate through research and data how it impacts the overall well-being of people, that will bring more funding opportunities, that will establish it and sustain it within our healthcare structure and make it more available and affordable to those that aren't able to access it now.
Yeah. And I would say just a couple other notes. I think back to Alana's performance, right? What a more tangible illustration of like the arts in action to communicate a message, right? To communicate an idea. Like that is poetry in motion, right? That is a perfect example of kind of this intersection. And how we can really rely on the arts to tell the story as a tool, a storytelling device. And I think too, like thinking about what your partner's motivations are, right? Like that the arts really matter to what they care about. So whatever their motivators are, like there's an artistic reason, or there's a reason why the arts kind of are of value to that motivation, I think.
I love this. I love this. We're really bringing it back to, yeah, what we as people, we're not just supporters of this program. We ourselves are people who know the power of art firsthand, and that can often be such a powerful case. So this is all brilliant. We've talked about, how this can be powerful for reducing pressure on clinicians, how this can be a form of achieving greater well-being. And I do want to touch on a big overarching theme in this panel, which is health equity. We've talked about, this is also a big experiment in understanding, can this reduce healthcare disparities? Can this help restore and repair some of the inequities that exist in our communities? I'm curious if each of us could comment from our own unique angles and lenses, how this Arts on Prescription pilot is achieving that goal.
to start that, like by design, our program is really aiming to serve those who might not have the resources themselves to connect with arts and culture. So I think on a kind of communications, like the communication standpoint that I mentioned, like initially, like we want everyone to know, right, that the arts are good for your health, and those with resources can then choose to engage in them how they like. But at NJPAC and through our arts and wellbeing initiatives, we are really trying to design programs that provide more access to those who might not already have it. And we know through the research that the arts are a access to and engagement in the arts are social determinants of health. And so by connecting people with these resources, we are providing real health value to them.
Ketlin, did you want to share next?
Sure. Having worked in the public health field for most of my professional career and here in the health center, one of the things I commonly see are individuals who are dealing with depression and anxiety, PTSD, and that's not being treated very well. We obviously there's medical interventions and other clinical forms of intervention, but these mood disorders and these mental health disorders are creating a strain on our society, and it's diluting our quality of life. And as a consequence, threatening our public health, right? So, what does it look like when you can incorporate an intervention outside of traditional medicine? These interventions that foster pleasure, mindfulness, creating a sense of serenity within an individual, offering them an opportunity to escape or at least have a distraction from the daily stresses of life. We can't necessarily eliminate all the daily stresses of life, but we can offer people an opportunity to experience some level of reprieve from those daily stressors, right? So I think, and I'm not a doctor, so I don't want to come off sounding like one at all, but I think the doctors will tell you that, people are experiencing art, whether it's creating it or viewing it or appreciating it, it has this way of activating like the reward systems in our brain. It releases healthy hormones and feel-good chemicals like dopamine and serotonin and oxytocin, and these trigger a sense of pleasure and positive emotion. So being able to give people more opportunities to feel good, right? I think is so important, and I think that will definitely have a ultimate impact on their health and well-being. I think that's just so important.
So well said. Maureen, did you want to chime in as well?
Yeah, well, Ketlin, I love that you said that, and it's true that anyone that's experiencing, and I don't know, many people that haven't at one point in their life experienced some level of depression or anxiety, and it may be someone that's their basic, framework that they're coming from, or they're a caregiver, and so they're experiencing this as a result of caring for people in their life. And when we do talk to our therapists, we talk to our doctors, they're going to say, they tell us many times, we need to distract. You need to find something that will help you take your mind off of things for a little bit. So that might be for somebody, oh, I'd like to just sit in my car and blast the music, or I want to just, watch a movie, or whatever it may be that's distracting us. With this pilot, it is giving access to these interventions. Currently, because it's a pilot, we have no barriers to any of the insurance plans. So whether it's a commercial plan or it's a government plan, all of our members have access to this. So there is no barrier from an economical or any kind of way, and members have full access. So I just think that piece has been really very, very positive.
Yeah, and there's still stigma about mental health, and especially messages that we receive in our families of origin, in our marginalized communities. And to be able to access arts and have that conversation be a starting point to how am I feeling better, and what are some ways that I can have access to the arts and still be able to talk about my mental health in a way that there might be mistrust that I have, even from a historical perspective with the medical community. So how do I find trust again with the community that I have, and how do I start to have that conversation and reduce that stigma about mental health? And so it really does open up access on multiple levels.
Brilliant, brilliant. There's some great discourse in the chat. I have a question sort of pulled from the chat that I want to ask. But before that, I just want to address sort of an elephant in the room, which is that this is a historical moment, but everything you're saying, it's so intuitive, right? This makes so much sense. Should have existed for years, but it hasn't. So I'm curious if each of us could comment on what has been the biggest challenges in actually getting this up and running. It was no small feat, I know. And it sounds like we have a lot of people working in different parts of the healthcare sector, schools, senior centers. So for folks, maybe interested in trying to initiate their own pilot, I'm curious if each of us could talk candidly about some of the challenges they've faced.
It's the money. It's the money. And thankfully, this partnership with NJPAC has given us an opportunity to cover the cost of providing this opportunity to our patients and to our residents here in the city. But it really comes down to funding for a lot of institutions.
Yeah, I'll say, we started, small, right? Because we needed to. And to like figure out how this would work in practice. I came on board at NJPAC in July of 2022. We'd had a whole year of just planning. We had the arts roundtable, the healthcare roundtable, like series of biweekly meetings with Horizon. Then as Rutgers came on board, biweekly and monthly meetings with Horizon. So there's like a lot of legwork, figuring out HIPAA protocols, figuring out the tracking method, how we would track this. Shout out to our Salesforce team, our IT department, who built us like a custom module in Salesforce to track all of this. So we have a dashboard that shows us, what stage of enrollment people are in and how many prescriptions they've received and how many guests they've brought. And it shows us, if they're attending observational or participatory activities and the modalities. It's really robust and awesome, but it took a couple months to build. Figuring out that referral process. Okay, how does someone get a referral? How does someone get into the system? Once they're in the system, what kind of data do we need? Are we surveying them? How often are we surveying them? These are all, and we've just completed the first year, or we're about to, 4 days from now, it'll be our 1-year anniversary. And then we're doing a whole process evaluation to figure out what needs to change as we bring the Department of Health on. And big thank you to the National Endowment for the Arts, whose funding allows us to open this up to the Department of Health and the Federally Qualified Health Center in Newark, because that funding piece is really important, right? We had the funding from Horizon initially to spearhead this. Teresa was able to get the funding from that OSHI grant for the students, and now the National Endowment for the Arts will fund this expansion with the Department of Health. I think all of this is in service. We're another shout out to the Epi Arts Lab at the University of Florida Center for Arts and Medicine. This project is also part of their social prescribing implementation science study that is helping to build the evidence base for this kind of work in the United States, because folks like Horizon are really interested on the efficacy of these programs. Do these programs help to reduce overall healthcare costs? Does it reduce ER visits and services? Can we make the case for these to be covered reimbursable through Medicare and Medicaid? I did the math. I had a presentation this morning. We're averaging less than, like, yes, cost is a barrier, but we're averaging less than $40 per prescription. I would challenge anyone to look at their most recent health statement and find anything for less than $40. You know, the arts are an available, affordable, and underutilized resource in terms of healthcare. So yes, funding is a barrier, but it's also an opportunity.
Yeah, and I would also say that beyond the funding, data is so important. And how are we collecting that data? I know that especially in the student community, we are definitely throwing out surveys pretty often. And so they can feel survey fatigue. But the data is so important, from getting the demographics to understand, who is getting access to this resource. Are we reaching all of our populations? And, being able to support the continuation of this has been important. And it's also been exploring dosages. So when we're talking about, okay, it's one event for 6 months. And then if you have a student population, we've talked about, well, how do we still continue access? Will that affect research with dosages? And do we pause over the summer because some of the students may not be in the area? How can we still encapsulate the data? Are we looking at, a 3-month program? And maybe that would feel a little bit more accessible where we can capture the data. So we're always looking, can we have the needs meet, the program allowances, where we're really capturing the data that we need to support the continuation of the program. So that's been sort of a challenge.
Yeah, I think that Allie certainly captured a lot of the challenges that we've been experiencing over the course of the year. Transportation, of course, is one, and that, of course, goes, hand in hand with the cost. And from my perspective, from an insurance company, like, we have a lot of regulatory issues we have to work around, HIPAA, and so connection to the members is very limited, and we've had to be very careful in terms of how we get the word out to the members so that they have access. And so that I think is one of our bigger challenges in the course of just how we've been working things in the company. And you'll start one way and you figure out a plan, and then something shifts and you've got to, change gears and figure out another plan. I will say this, that all of the participants in working so hard for this pilot, for this program, are dedicated. And so there is constant creativity and willingness to problem solve, and to do so in an expedient way, that things keep moving positively, moving forward.
This is brilliant. Touched on a lot of things there. One, coming back to Ketlin's great point earlier, we know there's so much research showing that the arts literally have a physiological benefit on us. This is not surprising. Lots of folks are commenting on the chat that this is not new. Humanity, since the dawn of time, has been using art to heal. It's coded in indigenous wisdom, and it's so obvious. And yet, I really appreciate the candid points that we need data to show this, and the money is a barrier. And we can be encouraged by our friends in the UK in their social prescribing programs. They've demonstrated that this can actually save money over time. For every £1 invested in social prescribing, 2 to 8 gets returned. We've seen data that shows this reduces hospitalizations, reduces doctors' visits. Really, really encouraging stuff. But I appreciate the fact that in the modern day healthcare, we need to speak their language and show it in a certain way. And so on that note, we've had a lot of great questions and comments in the chat, excitement to bring this to schools, to senior centers, to religious institutions. I'm wondering if folks can comment on, how and if they see this model being replicated beyond healthcare, really, if folks want to weigh in on that.
I can start, I guess. And Jules, like we were together at the social prescribing event in Boston a couple of years ago, and there's a guy there who's like, my neighbor noticed I gained 10 pounds and, saw me outside on my stoop and said, let's go for a walk. Like that's social prescribing, right? So I just think of, how can we have like naturally occurring social prescribing? And I saw someone in the chat too say, yes, this is indigenous knowledge, this is ancient knowledge. And here in the US, we've been kind of taught that art is only if you're talented at the arts. Art is only if you're gifted. Art is for the elite. Art is not for everybody. And there's a whole campaign right now, Arts for Everybody, part of One Nation, One Project, right? Art is for everybody. It's for every mind. It's for every life. It's for every soul. And I think that social prescribing programs are kind of a way to like reseed this idea, right? I was listening to something the other day about how, as we have deforestation. Like the solution for deforestation isn't just like planting the same tree everywhere in rows, right? That does not recreate an ecosystem. But if you, with like 16% of the land, you create these little islands of biodiversity and like put a tall stick where birds can land, and then these islands will connect. And I think of all of our social prescribing pilots in the US as like these little islands, right? And as we succeed in our own little islands, we can reach out and touch each other and connect. And this will kind of reconnect in an ideal world, this can like really reconnect our social fabric.
One of the examples I wanted to share is here at the department, we try and focus not just on the mental well-being of the patients that we serve, but also our own workforce. And so we have what we call Woosah Wednesdays, right? And so we've got a conference room dedicated, we dim the lights, we're playing soft music, we give the employees a little diagram and some markers where they can color and draw if they'd like. And it's maybe 15, 20 minutes out of the day, once a week or so, but it's just an opportunity to just breathe and relax and be mindful, connect with your own internal heart and spirit. A bit of a distraction from the stresses of the day. But I think, and we're also doing that across the different departments in the city. And so I think that's another way of experiencing this art as a form of therapy beyond just the walls of healthcare.
Yeah, and I really think of it as community building. Some of the offerings that we see on the prescription, a lot of the students are saying that they've never heard of it before, or they didn't know that they had different programs at the public library. And so it's a connection to also beyond this program, maybe I can continue this. And also, how do I take it home? Like, do I bring home, take some time and do some coloring at home, or what could that look like? And be very creative with how to adapt it for the needs based on time, or based on materials that we have at home, or based on, the different arts that we like to engage with. And so really having awareness of the community resources and connecting our communities together, and finding ways where we can really amplify some of our different arts programs that people just don't know about. And just to be able to bring that awareness, it can bring a community together.
Yeah, and sometimes when we are caught up in the day-to-day, whether it be just dealing with life's difficulties or a physical health issue or mental health issue, it doesn't occur to us to do something enjoyable. So just the idea, the presentation of the idea is like, oh my God, I'm so bogged down with bills and doctor's appointments and, you know, all these other pieces. It didn't occur to me that I could go and see a show, or that, you know, I could, you know, participate in a glass blowing or anything like that. It's like, wow. And this is because it's out of the day-to-day monotony, and being reminded of that and consistently being reminded. It's like when you first, you know, when the gyms first started to get involved with the insurance companies, right? You start thinking, oh wow, yeah, physical, like if I work out, it's going to be better for me physically, and my blood pressure is going to go down and my weight's going to go down and so on and so forth. You weren't thinking about it that way, but the more you talk about it, the more it's put in your mind, in your view, the more someone's going to drift towards it and benefit from it.
Yeah, I think some of like the best stories that we've gotten out of from the participants so far is like that kind of like internal shift that they've noticed. Like we had someone that, you know, they had a prescription for an activity one night, and their family member was in the hospital. And so it's like they almost canceled and didn't go, but they remembered like they're safe, they're taken care of, I'm doing this for me, like I'm gonna still go. And they attended, and you know, it kind of filled their cup, and they were like ready to take care of their loved one the next day. And they said, you know, this is reminded me to listen to music. I had stopped listening to music in my own home, and now I've got like the record player out, and I'm like finding like the music that I love again, and I'm like, you know, dancing by myself in my living room. And so like this kind of trickle down effect, that like these like little shifts in someone who was burdened by like caregiving and kind of like that external situations they're in. This was kind of a little bit of a light and a reminder that they could take care of themselves like through the arts.
Ali, that's so brilliant. And that's a perfect segue to the last question I wanted to ask the panel. You sort of just addressed it there. And this is also actually an invitation to folks in the chat to share as well. I'm seeing so many great people involved with art, beneficiaries of art, know that this is so healing. I'm curious if each of us could go around and share a story about a time that they've either witnessed art heal someone, have themselves been healed by art. Ali just shared that great story. I can kick it off just by recapping quickly one story from the book about this woman, Kuhn. Kuhn says everywhere else she went, she was a trauma story. Kuhn in her heart knew she wanted to be a novelist. She had this sort of awful childhood, lots of barriers in her way, culminated in adulthood in PTSD and depression. And everywhere she went, that was all she felt like she was seen as. And then she's given this creativity prescription. This is in Australia. And she says, you know, she was so low that she would have tried anything at that point. It never would have occurred to her to try an art prescription. But she said it was the one thing that made her feel like a person and not just a case study, not just a diagnosis. She said that before she went into this, she thought she was so broken and she couldn't do anything anymore. And now, spoiler alert, Kuhn is a novelist. She's an artist. She's back at work, and she says, I feel like I can do things with my life. I see the future now and I didn't before. So that's one. I see folks are in the chat sharing. That's great. Teresa, Ketlin, Maureen, I don't know if you have any other quick stories you want to recap.
So, you know, because of HIPAA, I don't hear as much from our members on their stories, but I can tell you from a direct practice aspect. You know, I worked in an environment where it was a partial hospital program, and it was group therapy focused. And we had one individual who was so closed off, would not talk, would not participate, and till he got to our music therapy class, and he lit up, and his guards were down, and you know, this was not a cure-all, not like your story, Julia, but you saw a window into connecting to him, and that we were able to tap into and continue through our work. And that's, I think, what arts prescription does. It allows for a window of entry into connection with people.
I guess I'll share a personal story just because it's just recently occurred. My husband and I had the opportunity to travel to Paris last week. And if you've been in Paris, it's full of arts and culture. And when we were flying back to Jersey, he'd been experiencing a lot of stress from work and so forth, right? As do we all. But he said, I feel ready to get back to work now. I feel good. I feel full of energy. Like and that kind of experience is what I want other Newarkers to experience, right? Whether it's a play or a concert or a show. Everyone should have the opportunity to experience that kind of woo-saw moment that we experienced from our trip to Paris. So
Beautiful.
Yeah.
Oh,
Sorry. No, I was just gonna share just another personal story of mine, that I've worked at Rutgers Newark for 20 years, and I have never been to Glassroots, which is such an amazing resource. And I've passed by it countless times. And it was only because of the arts prescription that I was able to go bring my partner, and that we were able to connect through that. And it's something was able to loosen in me, when you're retraining your brain, and I can decompartmentalize arts and work and arts and health, and something connects where, our brain is like, oh yeah, this is why I do this work. And why am I not applying this to myself? Because burnout is real, and we can really have time be a barrier to nourishing ourselves. And, it was just such a bright experience where it was just, wow, yeah, this is an aha moment where I need it in my life. I need it back in my own life, and not just within, developing it within communities. Where can it fit in my life? And I love that I was able to access it in Newark.
that's great, Teresa. It makes us proud. I would say, this as a kind of closing thought, we found that we're increasing awareness for programs that may be free or low cost. Like, we've heard from one person that discovered that that Newark Public Library has like a community knitting program. And they're like, well, now I have this. It's free. I don't even need your prescription anymore. I found my people. I'm going to go do this every week. And then for others that want tickets to NJPAC or Symphony Hall or Glassroots, where cost was a barrier, we're providing access through removing that financial barrier. And I would just echo everyone's thoughts. I'm a visual artist too, and I paint and I draw, and sometimes I feel like every time I sit down, it has to be like a masterpiece, right? And so there's like a lot of pressure on it. But when I joined like a community ceramics class for the first time in like a totally new medium, and I was able to just like play and learn, that was like so incredibly healing, right? And you can just like get in the zone on a pottery wheel for like 3 hours and just get into that kind of flow state. So that, I think that aspect of play is really important too, and joyfulness.
So beautiful, Allie, Ketlin, Teresa, Maureen. Thank you so much. I feel inspired to go out and play, to go out and curate my joy, and to go and practice some of the stuff we preach. Very inspired by all of you and everyone in the chat as well. Thank you so much for coming, for sharing your expertise and your insight and your experiences with this. Thank you for being part of this history. And we look forward to seeing you next time. And I think there were some questions about resources being shared out, this recording being shared out, contact info. And so, yeah, I hope that will all get to you, and we'll see you soon. Thanks, everyone.
Thank you.